Hello, everybody. So let's talk about the drug interactions, drug interactions of Saint John's wort. Saint John's wort is a plant. This plant has wide variety of uses in the body, and since ages, since ancient time, this drug was used for many purpose. So in today's class, let us try to learn about the drug interactions of this Saint John's wort and other drugs. If Saint John's wort is given along with narrotherapeutic drugs, what clinical significances can be seen, that all we're going to learn in this session. So before understanding about the drug interactions of St. John's wort, let me tell you the basic things about St. John's wort. St. John's wort, St. John's wort is a plant. Actually, it is a plant. This St. John's wort, the scientific name of this plant is Hypericum perforatum. Hypericum perforatum. This is the scientific name of this plant. Since ancient time, this plant was used for so many purposes. Okay, initially in olden days, it was used for different conditions. Particularly, it was used as the antidote. It was used as antidote for different poisoning conditions. So, in majority of poisoning conditions, this Saint John's wort, Hypericum perforatum, was used as. But later on, due to its lethal adverse effects and its different pharmacological actions, it was not used. But today, currently in market, St. John's wort is used in homeopathy. In homeopathy, actually, the St. John's wort has different formulations. It is available as tablet form. It is available as cream and ointment. And it is also available as St. John's wort tincture, and it is available as powder. All these different formulations are used in homeopathy and in Ayurveda, in alternative medicine. In alternative medicine, only this St. John's wort is very commonly used, especially in homeopathy. In homeopathy, this St. John's wort is very commonly used. Now, let me tell you, see, this St. John's wort, Hypericum perforatum, has some claims. It claims that this St. John's wort is very effective for depression. It is used for anxiety. And it is also neuropathy, very, very important, neuropathy. It has certain claims that the St. John's wort is used for depression, anxiety, neuropathy, and certain pains, and it is used for so many other disease conditions without any claim. And today, the allopathic medicine, when they studied on this St. John's wort, it was observed that it can be used for depression. It is having antidepressant activities, but these antidepressant activities are not as useful as other effective drugs in the market. So, despite of having its antidepressant activities, it is having many other lethal consequences that we'll discuss now. Now, see, it just now, so far what we have discussed, St. John's wort, the Hypericum perforatum, is available in tablet form, ointment, tincture form, powder form, and it is useful in depression, anxiety, neuropathy, and different pain conditions. And along with this, it is used for different conditions. And all these claims are done by homeopathy, homeopathic alternative medicines, and in Ayurveda also. In Ayurveda, they are prescribing this St. John's wort for different conditions. But you have to remember, being a clinical pharmacist, we have to be very clear that whenever St. John's wort is used in the hospital along with other allopathic drugs, it will show different drug interactions that I'm going to tell you. See, before understanding about these drug interactions, let me tell you some other basic points. We all know that narrow therapeutic drugs, particularly the drugs which are anticoagulants, decoxin, we have immunosuppressants, we have warfarin, oral contraceptives, and we have certain drugs, we have antiarrhythmic drugs we used in arrhythmia. Okay, all these are anti-cancer drugs. All these are narrow therapeutic drugs. Small alteration in their drug concentration can cause lethal consequences. It may fail the therapy, or the alteration in the drug concentration, it may cause lethal adverse effects. Both the things are possible. And treatment fail can be seen. So when St. John's wort is given, it will interact with therapeutic drugs and it will cause failure in the therapies. I'm going to explain in each examples of each drug. Okay, now listen carefully. We have certain enzymes like cytochrome P2E1. These are cytochrome P450 enzymes which are present in the liver in phase 1 chemical reactions, in phase 1 metabolic reactions. All these enzymes are useful. So among those cytochrome P450 enzymes, cytochrome P2E1, cytochrome P3A4, very cytochrome P3A4 and cytochrome P1A2. Cytochrome P1A2. So these are different cytochrome P450 enzymes which are responsible for metabolism of all these drugs, therapeutic drugs. Let me tell you in detail. For example, cytochrome P3A4 is the enzyme which will metabolize the following drugs. It metabolizes cyclosporin, it metabolizes acrolimus, it metabolizes paclitaxel, it metabolizes etoposide. We have certain anti-cancer drugs, vincristine and vinblastin. These are very special vinca alkaloids, we call them. The main adverse effect of these drugs are neuropathy that we have discussed in our oncology lecture. Anyways, so even these two drugs are metabolized by the cytochrome P3A4 enzyme. And along with this, some azoles like itraconazole, ketoconazole, and some macrolide antibiotics like clarithromycin, erythromycin, and we have certain drugs like statins. Statins will cause myopathy, remember, and hepatitis. And we have benzodiazepines, and and mainly digoxin. Okay, so all these are the, along with this, there are so many other drugs which are metabolized by the cytochrome P3A4 enzymes. What St. John's wort does is, St. John's wort will, what it does is, it will induce these enzymes, it increase the concentration of these enzymes. St. John's wort will increase the concentration of these enzymes, and what it does, immediately this enzyme will metabolize all these drugs. All the drugs will be metabolized rapidly, and with that, it will fail the therapy. That means vincristine and vinblastin, both the drugs are rapidly metabolized, and it will fail the anti-cancer property. It will not show anti-cancer properties. And here, cyclosporin, tacrolimus, all these are drugs used in organ transplantation, and with that, organ transplantation therapies will fail. Organ rejections can be seen. Okay, and here statins, benzodiazepines, digoxin, all the activities will decrease in the patient. So this is one very, very important drug interaction. Main drug interaction is St. John's wort will induce the cytochrome P450 enzymes, and with that, it will immediately metabolize the other therapeutic drugs and it will fail the therapy. And second major interaction is St. John's wort will induce P-glycoprotein. Actually, this P-glycoprotein is a membrane transporter protein. This protein is mainly, it is concentrated in liver, in kidneys. It is concentrated in GI tract and also in blood-brain barrier. So this P-glycoprotein, which is, just imagine this is a cell membrane or a membrane, and in the membrane this P-glycoprotein is available. So what this P-glycoprotein does, P-glycoprotein will remove the molecules or drugs from the cell into outside the cell. It will eject the drugs out of the cell. And what this St. John's wort will induce this P-glycoprotein. And due to induction of this P-glycoprotein, the activity of P-glycoprotein will increase, and with that, what it does, it will remove the drugs from the cells, and with that, it will decrease the activity. For example, if patient is cancer and are giving vincristine and vinblastin anti-cancer drugs to kill the tumor cell. Once the vincristine and vinblastin enters into the cell, what happens? On the cell membrane, we have P-glycoproteins. These P-glycoproteins will immediately remove the drug outside, and with that, it will fail the therapy. The tumor cell will not destroy. It will not be destroyed by the vincristine and vinblastin. So P-glycoprotein is the efflux protein. It is the protein which removes the drug from the cells. Okay, so St. John's what it does, it will induce the P-glycoprotein, and here it has multiple activity. In drugs are metabolized. When drug enters into the liver cell, immediately the liver cells will remove the drug out of the body, out of the liver, and with that what happens, the drug concentration will increase in the plasma, and with that it may show toxicity also. And in kidneys, excretion may be decreased, GI tract absorption may be decreased, and barrier, the activity may not be seen in the brain. For example, if anybody is suffering with um, meningitis, and in that case we have certain antibiotics to decrease the bacterial growth, so in that case the drug will not enter into the brain, because in BBB the P glycoprotein will remove the drug, it will not allow the drug to enter into the brain. So due to the induction of P glycoprotein, it may either decrease the activity of drug or it may increase the concentration of the drug, and it can cause, both the things are possible. This is second drug interaction with St. John's wort in the body. Now, let me tell you, there are two main molecules which are available in the St. John's wort. One is Hypericum, we call it hypericin, and we have hyperforin. Hyperforin. These both the molecules are concentrated or the pharmacodynamic molecules which are available in the plant St. John's wort. So both these molecules are further studied. They are under study. And hypericin, they are having some pharmacodynamic actions, like some of them are having serotogenic properties, and with that, when St. John's wort is given along with SSRI, it may cause syndrome, serotonin syndrome. So this is another third drug interaction with St. John's wort and SSRIs. And when serotonin syndrome is induced, it becomes the emergency condition where patient will develop blood BP hypertension rapidly, and it is the dangerous condition. So all these are drug interactions which are seen with St. John's wort. So being a clinical pharmacist, always remember, when a patient is taking St. John's wort, we have to ask them whether they are consuming these drugs in or in topical. If they are taken through oral form, always remember they may cause potential adverse effects and they can cause drug interactions. So when patient is taking St. John's wort in oral route, along with those drugs, always remember oral contraceptive pills may fail the therapy. Oral contraceptive activity may fail, or when a patient is taking antibiotics, the activity may fail, or when patient is taking immunosuppressants in organ transplantation, immunosuppressants, in that case also it may fail the therapy. Remember these points. And along with these drug interactions, St. John's wort is having some adverse effects. It can cause GI irritation, it can cause abdominal pain, it can cause allergic reactions, it can cause um, bleeding. Okay, so all these are adverse effects with St. John's wort. And remember one thing, in allopathic medicine, it suggests St. John's wort for depression. Okay, it is having only claims, and there are so many other researches are going on these two molecules. Okay, these two molecules are further studied, and specific dose and their adverse effects and everything is studied. So never suggest patient with St. John's wort. And if anyone is taking St. John's wort, be very careful with drug interaction.